Welcome to The Explainer. Today, we're unpacking a brand new white paper that, honestly, it has the potential to completely revolutionize IVF access in India. It's this massive topic sitting right at the intersection of healthcare, policy, and human life. So let's break it down. But before we get into the heavy policy details, I want you to consider a pretty fundamental question. Is building a family a luxury? Because for a lot of people right now, practically speaking, the answer is yes. The stakes here are deeply human. We aren't just talking about healthcare codes or bureaucratic budgets. We're talking about the fundamental human desire to have a child, and the immense structural barrier standing in the way of that.
Okay, let's dive into this, because the reality on the ground is stark. For the average family seeking IVF in India, the cost burden is typically 100% out of pocket. Imagine, for a moment, facing this incredibly emotional, physically demanding medical procedure, and then simultaneously you have to drain your entire life savings or take on crushing debt just for a chance at a successful pregnancy. It's a staggering financial barrier. It literally stops millions of people from even trying to access the care they desperately need, long before they ever set foot in a clinic.
Here's our roadmap for today's Explainer. We'll look at the fertility care gap, the insurance blind spot, the white paper's proposal, reforming Ayushman Bharat, and finally, the impact of IVF access.
Section 1. The fertility care gap. Rising need, crippling costs.
So, infertility is rapidly becoming a highly prevalent public health issue in India. And as these rates rise, the necessity for medical intervention grows right alongside them. IVF is no longer just some niche, elective procedure for a select few. It's an urgent, fundamental healthcare need. Yet, despite this skyrocketing demand across the country, the actual treatments remain stubbornly out of reach for the vast majority of the population. We're watching this gap, the gap between those who medically require care and those who can actually afford it, widen every single day. Section 2. The insurance blind spot, stranded without coverage. And this brilliantly illustrates the exact core of the current crisis. We have the exceptionally high recurring costs of IVF treatments, which, by the way, rarely just require a single cycle, crashing into practically zero private insurance coverage. Families navigating fertility challenges are entirely failed by the current financial systems. They're left carrying a mountain of medical debt without any structural safety net to catch them. They are essentially trapped between their healthcare needs and their financial survival.
Section 3. The white paper's proposal, a vision for reform.
Now, a newly published white paper has stepped into this exact void, advocating for sweeping, systemic changes to the insurance market. Their core thesis is crystal clear: democratizing healthcare needs by reforming insurance to improve IVF access. What they're proposing is a total reframing of how we view this entire issue. They're arguing that IVF must be shifted from being a luxury expense only afforded by the wealthy to a fundamental healthcare right that is accessible to all. Let's break down exactly how they plan to bridge this care gap through 3 key policy recommendations. First, it calls for officials to formally recognize fertility treatments as essential care, completely changing its medical classification. Second, it recommends mandating the inclusion of these treatments in private health insurance policies, so folks paying for private insurance can actually use it for family planning. And third, and perhaps most importantly for the broader population, it suggests integrating this coverage into national public health schemes.
Section 4. Reforming Ayushman Bharat, the public health mechanism.
To understand the sheer magnitude of what this white paper is proposing, well, we first need to understand the program they're targeting. Ayushman Bharat is a massive national public health insurance fund run by the government of India. Its stated aim is to provide free access to health insurance coverage for low-income populations across the country. We are talking about a system designed to cover hundreds of millions of people. It is arguably one of the largest public health infrastructures anywhere in the world. Now, what's really interesting about this proposal is how it specifically leverages this existing infrastructure. The white paper advocates for explicitly bringing IVF under the Ayushman Bharat umbrella. By doing this, it would instantly bypass the private insurance market and provide a crucial lifeline for millions of low-income citizens who could never otherwise dream of affording fertility care. It's all about utilizing a massive, already functioning public tool to democratize access to a very specific, vital medical need.
Let's look at how this builds a clear path from a recommendation to a reality. How does a white paper recommendation actually become real-world policy? Well, it follows a distinct track. Step 1 is where we are now, the formal policy recommendation being published and debated. Step 2 requires extensive government bureaucratic review, where officials meticulously assess the financial and logistical viability of the proposal. If approved, Step 3 is the actual structural integration of IVF codes into the Ayushman Bharat system. And finally, Step 4 is the ultimate outcome,
broad, standardized public access to IVF across the country, transforming a policy idea into a life-changing reality.
Section 5. The impact of IVF access, changing the future of public health.
You know, it's incredibly easy to get lost in the dense bureaucracy of insurance codes, government reviews, and white papers. But here is why this truly matters. The crucial point is that redefining fertility treatments gives families a chance to grow without facing catastrophic financial ruin. We're talking about preventing everyday families from being pushed into deep poverty by unexpected out-of-pocket health expenditures. This policy shift directly connects those dry bureaucratic changes to tangible, deeply meaningful human outcomes.
I want to leave you with a provocative thought today. How could redefining fertility as a standard healthcare right change the future of public health as a whole? If we recognize that the ability to build a family shouldn't be gated by personal wealth, what other essential treatments might we need to reevaluate in our society? It's a fascinating question, and one this white paper absolutely forces us all to confront. Thank you so much for joining me for this explainer. Keep questioning, keep learning, and I'll see you next time.